Well, good morning, everyone, and welcome to our first of 3 information sessions about best practice spotlight organization. And it's my absolute delight to welcome all of you to the call today. So we'll let you know that we are recording this webinar today, and we will have it available on our website for your reference in the future. My name is Heather McConnell. I'm the Associate Director for Guideline Implementation and Knowledge Transfer at the Registered Nurses Association of Ontario. Dr. Valerie Gerdiza, the Director of the International Affairs and Best Practice Guidelines Center, is unfortunately not able to join us today, but certainly will be joining us at future webinars and teleconferences. So the session objectives for today will be to describe the Best Practice Spotlight Organization Designation Program and the process for becoming a BPSO. We'll discuss the eligibility requirements for organizations interested in applying. We'll describe the pre-designation deliverables that are a part of the contract and part of the program. We'll identify supports provided by the Registered Nurses Association of Ontario, and I'm hoping that we'll have an opportunity to answer any questions that you might have or seek clarification of the application process and the deliverables themselves. If you do want to ask a question, we'll ask for questions we'll respond to questions at the end of the session, but certainly you're able to enter them in the chat box that you'll see at the bottom right-hand corner of your screen, and we'll capture any questions that you might have during the course of the session. At the end also, we'll be able to unmute the lines. So currently the lines are all muted, and we'll have you unmute your line if you'd like to ask a question verbally. So the Registered Nurses Association of Ontario, for those of you that aren't familiar with the RNAO, is the professional association of registered nurses, nurse practitioners, and students in Ontario, Canada. And the Best Practice Guidelines program is a signature program of the RNAO. This is the model that we utilize to guide the work of the International Affairs and Best Practice Guidelines Center, which incorporates the BPG program and the Best Practice Spotlight Organization designation. You'll note the 3 circles address different elements of our guideline program. Guideline development, the top circle, the bottom left is dissemination, implementation, and sustainability. The far is focusing on evaluation and monitoring, and of course we're doing all of this to focus on outcomes for patients, clients, residents, providers, organizations, and the health system as a whole. So today we're going to focus on the dissemination circle, which is where the BPSO elements are managed. So right now we have 41 clinical best practice guidelines, 12 system and healthy work environment guidelines, and 2 implementation toolkits. And it's these resources that are really the focus of the BPSO initiative. So focusing on best practice spotlight organizations, the overall goal of the Best Practice Spotlight Organization Designation Program is to influence the uptake of best practice guidelines across all healthcare organizations to enable practice excellence and positive client outcomes. And there are a number of objectives within the program itself. And we're really focusing, and this is our first BPSO request for proposal that has actually included a specific focus for both service agencies and academic entities. So this RFP is for those agencies that are providing direct patient care, community services, and academic entities such as schools of nursing at colleges and universities. And again, it's really a focus of creating evidence-based practice cultures in the organizations through the systematic implementation of multiple RNAO best practice guidelines. And so the objectives really include establishing dynamic, long-term partnerships that positively impact client care, supporting evidence-based practice, being able to demonstrate creative strategies for successfully implementing best practice guidelines at the individual and organizational level, to establish and adopt effective and consistent approaches to evaluate implementation, utilizing structure, process, and outcome indicators, and identify effective strategies for system-wide dissemination of guideline implementation and the impact on outcomes. So there have been several different models and types of BPSO. So I've spoken already about service BPSOs and focus on evidence-based practice to impact client outcomes. And we have best practice spotlight organizations at the service level in acute care, home care, public health, primary care, and we also have a program that's specifically tailored for long-term care settings. And that program isn't the focus of this webinar today, but do know that we do have a tailored program for long-term care homes that is supported through our best practice, long-term care best practices program. Academic best practice organizations focusing on evidence-based nursing education to impact client and student learning and client outcomes. And secondly, the models of BPSO. So this RFP right now is really focusing on BPSO directs, where organizations developed a contract directly with RNAO to work for a 3-year period to become a BPSO designate, and as a designate continues that relationship with RNAO. So anybody applying for this particular RFP would be considered a BPSO direct. For some of our work in other provinces and internationally, we have BPSO hosts. And BPSO hosts are organizations that develops a contract with RNAO to oversee the BPSO designation in their particular jurisdiction. So in this case, we're working with the BPSO host, and then the BPSO host would be working with BPSO direct organizations within their jurisdiction. But for the purposes of this RFP, we're really focusing on service BPSOs, academic BPSOs that use the BPSO direct model. Now, in terms of the various elements of the BPSO program, and I'll speak to each one of these individually, but just to give you an overview initially, organizations partner with RNAO to implement a minimum of 5 clinical BPGs over a 3-year period in order to achieve BPSO designation. There's an application process, which is what we're going through right now through the request for proposal. And for those organizations that are selected, they establish a formal partnership with RNAO through letter of terms of agreement and a contract. The specific requirements for the Best Practice Spotlight organization is the systematic guideline implementation. And again, as I said, a minimum of 5 clinical guidelines. There's a focus on capacity building, participation in knowledge exchange, expectations related to dissemination, participation through measuring outcomes through the use of standard indicators, expectations around sustainability planning, and ultimately reporting. As a designated BPSO, after the 3-year period, and assuming all deliverables are met, organizations are designated as best practice spotlight organizations, and during the designation period are expected to sustain the use of the guidelines that they've implemented, look for opportunities for expansion and spread to other areas of the organization or other curriculum elements, and again, participate in mentoring opportunities of new BPSOs who are coming into the program. And those mentoring opportunities may be locally, across the province, maybe within the country of Canada, or could potentially be internationally as well. So this just gives you a bit of a description or a visual of where the BPSOs are located in Ontario. We have 61 Ontario Best Practice Spotlight organizations representing more than 300 healthcare and academic organizations. And you'll note that some of those are long-term care homes in the green, and the red are other sectors. Internationally, we have 101 Best Practice Spotlight organizations that are direct, that work with us directly with RNAO, and 5 BPSO hosts that represent more than 500 healthcare and academic organizations. And I should mention that our global and international BPSOs are not funded through the Ministry of Health and Long-Term Care of Ontario, nor are they funded by RNAO membership dollars, but these organizations that are working with us internationally are funding their involvement in the program directly. We don't charge for participation in the program, but we do look for supports in terms of any travel or out-of-pocket expenses should we need to travel to or have some of our BPSO leads travel to support orientation. So I'm going to speak now about the BPSO eligibility criteria. And again, this is the criteria for the BPSO call that will be in effect from 2018 to 2021. So organizations are considered eligible to apply if they meet the following criteria. And I have a few slides about the criteria, so I'll go through them individually. You need to be able to demonstrate strong, explicit support from the board or your council, the senior management, whether that be a CEO or a president, senior nurse leader, a CNE, a CNO, or a dean or director, nursing staff, faculty, students, union leaders, and other key stakeholders. It needs to be clear that there's a vision or mission and or a mandate that provides an opportunity for leveraging other initiatives related to evidence-based practice, quality improvement, patient safety, student experience, and or outcomes improvement. So again, looking at your own vision statements, is there some connection to evidence-based practice, quality clinical care, et cetera. There needs to be a demonstration of a commitment to evidence-based practice by previous implementation of one or more RNAO clinical best practice guidelines into the practice or curriculum. And there needs to be, seen that their staff have been supported to participate in opportunities to develop capacity in evidence-based practice. That could be participation in the Best Practice Champions Nurse Network, having participated in the Advanced Clinical Practice Fellowship Program, possibly RNAO professional development offerings, and other quality improvement capacity building initiatives. Organizations that are eligible also have the capacity to implement, monitor, and evaluate nursing best practice guidelines, including the collection and submission of data on nursing practice, client outcomes, and organization structure indicators, and baseline and post-implementation interviews. And also has the capacity to commit a BPSO lead, and this should be an RN, preferably master's prepared if possible, to support implementation, evaluation, and sustainability activities. Also organizations have just demonstrated the ability to engage in successful partnerships with the healthcare and academic communities. So other activities that you may have conducted or projects in your workplaces where you've worked with key stakeholders and others within your community is an important aspect, and has the capacity to meet the requirements of the terms and conditions of the BPSO designation in order to maintain the BPSO status after 2021. So those are the eligibility criteria for organizations that are considering applying. So now what I'm going to turn to are the deliverables, and I'll go through these individually so that we can have some dialogue at the end if you have specific questions, but these are outlined in the RFP as well. So again, at minimum, the Best Practice Spotlight organization will commit to engaging in a 3-year partnership with RNAO to be reviewed and renewed annually, provided criteria are met. So how this is structured is that our initial contract with any of the successful applicants will be for a 1-year period. At the end of that 1-year period, we'll have an opportunity to meet and review the progress made to date, and assuming that the deliverables are being met, we will issue a second contract for year 2 and a similar process for year 3. To ensure that there's opportunities for dialogue and ongoing discussion related to the progress of organizations. Necessary that you'll contribute the necessary resources to support this work at minimum to match the budget from RNAO. And we'll talk a little bit more about the budget later in the teleconference, but there is an expectation that there would be matched funding at minimum on the organization's commitment. That the minimum will commit to engaging in regular knowledge exchange, monitoring, planning, and evaluation sessions, including submission of semi-annual reports to RNAO regarding progress made towards deliverables. So again, opportunities during those semi-annual reports to have dialogue and discussion about progress being made and helping to identify supports to enhance the program. And also to work with other BPSOs, exchanging knowledge and experiences and learning and supporting one another. So this might involve working with a mentor organization or working with other BPSOs within the cohort that you join to be able to learn and support each other through this work. So when we talk about systematic implementation, we're talking about implementation that takes a step approach in terms of utilizing the implementation toolkit that's based on the knowledge to action framework, the inclusion of a steering committee, a lead or a coach, capacity building and knowledge exchange, dissemination, evaluation, and regular reporting. So I'm going to speak to each one of these individually. So the implementation deliverables, as we've described, are such that there's to be 5 guidelines, clinical guidelines implemented in the organizations that's participating in BPSO, 2 of those guidelines need to be implemented across the entire organization. And that's really to ensure that all members of the organization are somehow impacted by the guideline implementation process and a focus on evidence-based practice. The 5 guidelines are to be implemented by the end of the 2nd year, so that the 3rd year of the pre-designation period can really be a focus on integration, sustainability, and evaluation. Now, this is a new approach for this particular call for proposals, where we've identified the various sectors that have been applying for BPSO and identified 4 to 5 guidelines in each of these sectors that are the top guidelines that are selected and being implemented currently. So based on this particular call for proposals, 3 of the 5 guidelines that you'll be selecting will need to be selected from this list. And depending on your sector, there may be some variation across the 4 areas. So 3 guidelines need to be selected from this mandatory list, and then 2 or more guidelines, if you choose to implement more than 5, can be at your discretion of the available published RNAO best practice guidelines. So again, part of implementation is having a steering committee, and in the RFP we call it a steering committee, but really what we're looking for is having some kind of a structure within your organization that's going to be guiding and monitoring the BPSO deliverables and providing support to your implementation teams. We also recognize and request that you'll have a BPSO lead, and that could be anywhere from a 0.5 to 1 FTE. It really depends on the size of your organization and the scope of the work that you'll be doing. But that individual, as I said before, would be an RN, preferably master's prepared, but they would be in a role within your organization where they would be able to lead and facilitate this work as part of their day-to-day activities, and they would be the key contact person for the RNAO in terms of the work that we'd be doing together. We will provide a BPSO coach that will be one of our staff members in implementation activities who will be able to support your BPSO lead and your implementation teams, and they'll be the key point of contact with RNAO for your BPSO lead. One of the other deliverables in the area of implementation is capacity building, and there's a number of capacity building deliverables, and I'll go through those individually. So the expectation is that there'll be a cohort of champions developed to support the guideline implementation work. And we've recognized with working with our BPSOs over the years that the champions are actually a critical success factor in being able to have enough people within the organization who have a strong understanding of evidence-based practice and are able to support the uptake of evidence within their own work and support those colleagues. So over the course of the 3-year period, there's an expectation that there would be 15% of nursing staff be prepared as best practice champions. We have a variety of different ways that best practice champions can be prepared. You may have best practice champions already in your workplaces. We have in-person workshops across the province of Ontario that are funded by the Ministry of Health and Long-Term Care and free for staff to attend. We do have interprofessional staff members that join these workshops as well. So that's certainly an opportunity for your interprofessional teams to participate as well. We also provide virtual workshops that are based through a webinar-based technology where we have 2 modules which are archived and are self-study, asynchronous activity, and then 2 modules which we need to register for and join as a synchronous learning experience with other best practice champions. And we are launching a new program, an e-learning program that will be available for complete self-study that is, again, based on the content of the Best Practice Champions workshop to support the preparation of champions across Ontario, Canada, and internationally as well. Another capacity building requirement is attendance at the BPG Institute, and we've just had the BPG Institute last 2 weeks ago, actually, in Horseshoe Valley, but we run this annually, and we have found that this is a really critical foundation for BPSO leads and others who are involved in guideline implementation to really have the knowledge and background to be able to support their planning and implementation of guidelines. So it is a requirement that an RN or an RPN be sent annually to either the foundational or advanced stream of the BPG Institute to support that capacity development. And over the years, our best practice spotlight organizations, as they become designated, actually become the faculty for the Clinical Best Practice Guideline Institute. Advanced Clinical Practice Fellowships is another requirement and part of the BPSO program. And over the course of the 3-year pre-designate period, it's a requirement for RNs to participate by submitting proposals to the Advanced Clinical Practice Fellowship program. Depending on the size of your organization and the number of staff, the number of proposals that you'll need to submit over that 3-year period will vary, and those details are outlined in the RFP itself. But if you're not familiar with the Advanced Clinical Practice Fellowship program, it has been in place since approximately 2001, and its goal is to develop and promote nursing knowledge and expertise and improve client care and outcomes. A focused self-directed learning experience for an RN or NP to develop clinical leadership or best practice guideline implementation knowledge and skills. And the support is provided by a mentor or a mentoring team, the organization where the nurse works, and the Registered Nurses Association of Ontario. And the focus for the fellowships can be on clinical practice, leadership, or guideline implementation. Now, because we've found that this particular focused experience for registered nurses is an important element for BPSO, the applications really do need to be in the area somehow related to your guideline implementation work that is part of your best practice spotlight organization activities, but it certainly could be in the area of clinical practice, leadership, or guideline implementation. The fellowships are 12 weeks in length full-time, or 450 hours spread over several months as a part-time fellowship. And the funding from the Ministry of Health and Long-Term Care for the fellowship is $13,000. And the organizations in which the nurse is employed is expected to provide a minimum of $5,000 of support to contribute to the budget. Other capacity building deliverables or knowledge exchange. So the BPSO lead and any other members of the BPSO team that would like to join will have monthly knowledge exchange webinars with BPSO leads, the RNAO coaches, and other RNAO BPSO team members. And this becomes our network of BPSO leaders in a particular cohort. This will be Cohort 6. And so all of the Cohort 6 BPSO leads will meet on a monthly basis. In the designate period, the frequency of the meetings decreased to quarterly, but we'll continue on having opportunities to meet and learn from each other. We also provide an annual BPSO Knowledge Exchange Symposium. This is hosted by RNAO and funded by RNAO for travel and accommodation through our budget from the Ministry of Health and Long-Term Care. And it is a full-day event where we gather together all of our BPSO designate and candidate or pre-designate organizations, BPSO leads, champions, advanced clinical practice fellows, our RNAO staff, etc. And we develop a program of knowledge exchange, and it's really based on what the BPSOs are interested in talking about, what they're interested in sharing with each other, and the faculty for the day really are the BPSO leads and champions. It's a great day. This year we had about 160 people in attendance, and it's always very, very motivating and energizing. Again, capacity building mentorship. So committing to working with a BPSO designate mentor organization as appropriate in order to develop guideline implementation capacity. So RNAO will identify BPSO mentors, those designate BPSOs who have already experienced the 3-year pre-designate period. We try to match organizations up as closely as we can related to their sector, the size, etc. And of course, there's always opportunities to learn from each other beyond a formal mentorship role through the network that you develop with your BPSO cohort. So this is just in summary the capacity building deliverables related to champions, advanced clinical practice fellowships, the Clinical BPG Institute, our participation in knowledge exchange, and mentorship. So in terms of dissemination, we definitely want to ensure that there's opportunities and expectations that the work that you're doing in terms of guideline implementation and the impact it's having on your organizations are shared with others. So there's an expectation as part of the deliverables that there'd be presentations at conferences, participation in RNAO events as faculty, and I mentioned the opportunity for BPSO designates to present at the institutes, but there's also certainly opportunities to present on some of our webinar series, champions webinars, et cetera, to share implementation resources, either through an online community or posted on our website. Manuscript submission. This is a pre-designate requirement that your organization will submit a manuscript for submission or for publication, either to a peer-reviewed or non-peer-reviewed journal, that you'd have a website, a BPSO presence on your website, that you'd have a social media presence, and of course the use of the BPSO logo in all related and relevant activities and publications. So monitoring and evaluation, nursing quality indicators for reporting and evaluation. I'm going to speak a little bit about the requirements here. So the goals of NQuire is to develop a robust data system for reporting, monitoring, and research that demonstrates the value of how evidence-based nursing practice improves health outcomes. And as the data system expands, it will impact practice, management, and policy decisions, education, and health systems research. And so how this works is that the organizations that are participating as BPSOs are all required to be reporting into NQuire. And this is not only true from our Ontario BPSOs, but also nationally and internationally as well. So at the far right left, you'll see that the clinical areas where BPSOs are working to improve practice, they're entering specific indicators and data into our NQuire data system through a web-enabled entry system. And then, of course, being able to access reports so that they can monitor and see how they're doing. And these reports can be single indicator reports or overlay reports where you can actually put different types of indicators over top of each other and see how they interrelate. So mandatory NQuire participation is at minimum requirement for NQuire is to submit monthly data on a quarterly schedule consistently for units, teams, programs, or services, however you identify those as outlined below. So for health service organizations, a minimum of 2 human resource structure indicators and 1 NQuire process and 1 NQuire outcome indicator for each of the 3 mandatory guidelines selected for implementation. And we'll have data dictionaries and a range of indicators for all of those guidelines. And of course, it would be up to you to work with our NQuire team to identify which ones would have most meaning for your particular organization and sector. Baseline data submission is required on a process and outcome indicators chosen for a period of 3 to 12 months if this data is available prior to the initiation of implementation activities. Now, for those of you that are from academic organizations, participation in NQuire will involve supporting the development and/or identification of process and outcome indicators measuring the impact of guideline implementation on student and organizational outcomes. And here's just an example of an NQuire report. You can see the initiation of BPG implementation. This is in relation to pressure ulcers on the far left, and the sustained practice change over a 4-year period. And again, here's an annual incidence rate of pressure injuries. This is in a home care organization that is reporting into NQuire. And here, falls rate for an Ontario hospital, again, over a period of years, sustained practice change related to the implementation of falls best practices. And this is an example from Tilbury Manor, one of our long-term care BPSOs, and you can see a number of guidelines that they've implemented over the years, and the sharp decline of specific outcomes for clients. And here is just an example of something we've just published recently called Evidence Boosters, and these again tell the story about the organizations that are implementing the BPGs and the impact that the implementation of those guidelines has had on their outcomes, and this is just an example here. So sustainability is another element in expected deliverables, and so we've learned through working with our BPSOs over the years that there really is a need for sustainability planning that starts early in the process. And so as part of your 3-year pre-designate deliverables, part of that work is actually developing a sustainability plan and starting to think about elements that need to be included in your ongoing activities within your organizations to be able to sustain practice change. And we'll help you with that in terms of using a specific model and different approaches to thinking about your organizational structures, your staffing, your processes, et cetera. So there are reporting deliverables as well. So BPSOs submit a written report twice per year, and this is in the pre-designation period, highlighting the progress being made towards deliverables. This report is an online report, and we provide a consistent template for all of our BPSOs to complete. The BPSO team at RNAO reviews each of the reports. That will include your coach, myself, the director of the program, et cetera. And we'll meet with the BPSO teams to highlight the successes that we see in your reports, reinforce successful approaches, ask questions, and discuss any needs that you may have for additional supports. And then the partnership with RNAO is reviewed and renewed annually, provided deliverables is met, as I mentioned previously in this webinar. So in terms of what we'll commit to as part of this BPSO work, we've talked about what the deliverables are for the BPSOs, and now I'd like to talk about what our commitments are to you. We'll provide our best practice spotlight organizations with free access, obviously, to RNAO's published guidelines and the nursing order sets. We'll provide BPSOs with an orientation to the designation program, specific guidelines selected, and implementation resources we have available. And some of that orientation will be done in conjunction with your coach, and some of that we'll do collectively together when we actually launch the Cohort 6, which will be taking place in April 2018. We'll all come together for a full-day meeting and have an opportunity to learn from each other and get started on the program. We'll also provide expert consultation on BPG implementation and uptake through the support of a coach during the 3-year pre-designation period, and that will take place either individually, by teleconference, by webinar, might invite site visits, et cetera. Our coaches will meet with your BPSO lead on a regular basis. We'll also support champion development and capacity building through provision of best practice champion workshops. I've spoken about the in-person and virtual ones, and a self-directed e-learning program. We also provide opportunities for our BPSOs and others to actually host champions workshops on site, and this certainly does help with access and capacity development. Provide support for implementation through the Best Practice Champions Network. So this involves a number of elements. Many of our BPSOs take regular advantage of funding that's available through our Champions Network for networking opportunities and open houses, et cetera, to really highlight the work of the BPSO within the organization. We'll also facilitate participation in a network of BPSO leads for the purposes of knowledge transfer and exchange through regular teleconferences and other meetings and events. And I've spoken a bit about our monthly knowledge exchange calls, and of course through our symposium and other opportunities for us to meet together, particularly at the Clinical Summer Institute. We also actively look for opportunities for BPSOs to participate in various aspects of guideline development, implementation projects that are underway and that come our way, and dissemination activities. I've already spoken about our annual BPSO symposium that we fund to support continued capacity development, knowledge dissemination, and networking with pre-designate and designate BPSOs. We'll meet with your team on a semi-annual basis to review reports, monitor progress, and provide recommendations. And we'll conduct one site visit over the 3-year period at a mutually agreed upon time to review on-the-ground implementation, monitoring, and evaluation activities. We can certainly come to visit more frequently than that, but we'll commit to coming at least once over the 3-year period. We're also committing to supporting a consistent approach to data collection of human resource structure, process, and client outcome indicators through Enquire, and we will provide relevant instruments along with instructions, education, and guidance for collecting and submitting these data, and we visit and meet frequently with our BPSOs, not only on our knowledge exchange calls, but also have consultations with them related to the selection of indicators that make most sense for them, how can they collect this data, focusing on data quality, etc. A number of in-person consultations via webinar, teleconference, and also have developed a number of tools through videos, etc., that you can access at any time to support your learning. In terms of financial contributions, RNAO is committing to providing up to $105,000 per Ontario-based healthcare organization or academic entity for the duration of the 3-year BPSO pre-designation period. So organizations are required to submit with their proposal annual budget requests to RNAO of up to $35,000 per year for a maximum of $105,000 over the 3-year agreement. And as I mentioned at the beginning of the webinar, organizations must commit to matching or exceeding the annual amount requested in each budget, so that there would be a $70,000 budget minimum per year if you were requesting $35,000 from RNAO. So the proposal evaluation is structured such that we're looking at the scope of work is worth 20% of the overall score, organizational support is worth 20%, previous experience with BPG implementation is worth 10%, the BPSO team knowledge, skill, and experience is worth 15%, capacity to deliver on BPSO requirements and sustain outcomes is worth 20%, and then the financial contribution and the budget is worth 15%. And so in the RFP itself, you'll see a series of statements and questions, not so much questions, but actual information that we're looking for in each of these elements of the proposal. And the actual online application form takes each of those areas. We'll ask you specific questions related to the work. So the application process, as I mentioned, is an online application based on the content outlined in the request for proposals. The access to the online submission form will be made available after the letter of intent deadline, and we'll cover those dates in just a few moments. The online submission will include specific questions with word limits that address all aspects of the RFP requirements outlined in the RFP itself. So when you're looking at the scope of the work, you'll notice that there's a variety of different things we're asking about in there, and we'll have specific questions within the RFP online submission form that will address each of those, and you'll also be able to see the word count and the word limit so that you'll have a sense of what level of detail we're looking for in the application itself. So in terms of the review process, we will have a BPSO review committee that will be responsible for reviewing all of the applications that we receive. Each proposal will be reviewed independently by 5 to 6 reviewers using an established scoring matrix. So we'll be looking for some very specific elements. Those 5 or 6 reviewers will include our BPSO coaches, BPSO leads from designate organizations, and members of our monitoring and evaluation team. Successful applicants will be identified based on the quality of their proposal, and RNAO will inform all applicants in writing of the status of their application. So important dates, the letter of intent is due July the 26th. Now the letter of intent is not binding, but we are asking organizations that are interested in applying to the RFP if they could provide us with a letter of intent. This helps us greatly with our planning for marketing as well as planning for the review process. The access to the online application will become available after the July 26th submission deadline for the letter of intent. The proposal submission deadline is October the 5th by end of day. Results will be released to applicants in January of 2018. And we'll use the time between October and January to review the applications, make decisions related to the distribution of the successful candidates, and of course actually initiate a contract submission and signing. The launch of the BPSO Cohort 6 will take place April the 10th, 2018 in Toronto, and that will be the date that all of the organizations that have been successful in the application process will come together to launch and provide an orientation of their BPSO work. So I've gone over the requirements for the eligibility. I've spoken about the deliverables, And I've got a couple of questions here in the chat box, but would be very happy to respond to any questions that anybody has. If you would like to answer questions,
the conference has been unmuted.
If you would like to ask a question, you'll need to unmute your line. I think what we'll do is we'll put the line back on mute. Overall, we're going to put the whole line on mute, and if you would like to press star.
The conference has been muted.
It's star 7, is it, Lolly, for you to unmute. So if you'd like to ask a question, it's star 7 to unmute your line. And in the meanwhile, while you're thinking about questions you might like to ask, I did receive a question about nursing staff include PSWs in long-term care. If you're a long-term care home, yes, it will. If you're in another sector, it really is dependent on your staffing model and structure, whether that would include personal support workers or not. But certainly we have included personal support workers in the Champions program, and they have participated actively with regulated staff at those events. So if you'd like to ask a question, you can type it into the chat, or you can be happy to respond to any verbally. And we've got one here. The question is, if we've already implemented one or more of the required BPGs, could we meet that required guideline by extending the implemented? Yeah, absolutely. So if you've already implemented one of the required mandatory guidelines, you could look at implementing that in other areas of your organization. You'll be possibly using a different approach in terms of a structured implementation approach. So you're absolutely able to look at the expansion of that implementation. I've had a question about eligibility for academic BPSOs as clinical ones. And yes, there are some variations in the application RFP itself where there may be some variation for the deliverables for academic BPSOs as clinical ones, but otherwise the expectation for champions, development of champions through faculty and student involvement is an expectation that there be a participation in the Advanced Clinical Practice Fellowship, that there be opportunities to participate in the knowledge exchange calls, et cetera, would all be similar. Where there's some variation in the requirements are specific to things such as NQuire, and I think I've outlined those as best I could during the course of the teleconference today, but they are highlighted in the RFP itself. Oh, I've just received a couple more questions here. Thank you. Somebody's asking about their priorities changing over the course of the 3-year period. So if our priorities change throughout the 3-year candidacy period, can we change to implementing a different guideline than first submitted? Yes, there certainly is some flexibility in the implementation process. And so if you find during the course of the early stages of your implementation work that there's a need to alter the guideline that you're implementing, you'd need to submit a formal request to do so. What we're really looking for is not a change in scope. So if you were implementing a guideline across the entire organization and you needed to change the focus, you would still need to implement a separate guideline across the entire organization so that the scope will be the same. But we certainly have had organizations that after the application process had changes in their services, programs, et cetera, and felt it was more beneficial for them to alter the focus of their implementation. Remembering, though, that you do need to have all of your guidelines implemented by the end of year 2, so there's not a lot of time for making revisions to the focus of your implementation. Somebody's asked about the annual contracts. Are they the same? They are the same, and will be based on the requirements for the RFP. So for the 3-year pre-designate period, the annual contracts that each site will sign will be consistent. And when you sign your, after your 3-year pre-designation period, and as you become a designate organization, the requirements do change slightly because it's a 2-year contract rather than an annual one. I've had a question about the number of organizations that will be chosen. We've had a range of BPSOs in each cohort, anywhere from probably 6 to 8 to 14. So I can't say exactly the number. It'll really be dependent on how many applications we get, the quality of those applications, the distribution of them, et cetera. But I can tell you that that's been the range in our experience to date. I've had a question about the nurses who require champion training. 15% is 15% of your nursing staff, so it's, they're asking whether that's exclusively 15% of RNs or 15% of RN and RPN combination, and it's 15% of your nursing staff, so that would be RN and RPN combination if that was your staffing model. Somebody's asked about budgets for the next year unknown for a period that will extend past the application date. Can a temporary budget and project scope be revised if funding is not available to match the full 50% later on? It is a requirement that the BPSO provides match funding to whatever they're requesting RNAO to provide. So if you were finding that you needed to modify your budget in year 2, for example, we could certainly look at doing that, but there would be a subsequent reduction in the funds that RNAO would be able to provide to you. And I have to tell you, we haven't had that circumstance in the past, but certainly we would work with you to be able to find a way through that. I've got a question here. In a public health context, would guideline implementation be considered cross-organization if we chose to implement in areas employing nursing staff? Some areas do not employ nursing staff and or provide direct service. And again, I think it would be dependent on the guideline that you were selecting. I know certainly all of our public health units that have participated in the program to date have implemented organization-wide in their programs, and it was really dependent on what guideline might be most appropriate for you to do that with. So implementation of nursing order sets, thank you for that question, and I don't think I mentioned this, but there is, and you'll note in the RFP that we're recognizing the use of nursing order sets either on your paper-based or electronic health systems, if possible, within those 3 mandatory guidelines. So it's certainly not an expectation for all guidelines you'll be implementing, but certainly the logical focus would be for those mandatory guidelines. And I think, yes, the nursing order sets are really focused on, they are specific to the recommendations of the guidelines themselves. They are the action activities, the interventions within the best practice guidelines, and they're coded to ICNP, the International Classification of Nursing, excuse me, for ICN. So those are the nursing order sets, and we can certainly make those available for you to review. Who has access to our organizational data submitted to Enquire? What are the data shared with or viewable by? That's a good question. And within the process of becoming a BPSO, you'll be required to sign, along with RNAO, an Enquire data usage agreement. And that data usage agreement outlines in great detail who has access to the data, who is able to see the data. Right now, we have a very limited number of our staff members that are on our evaluation and monitoring team who are able to access that data. And at this point in time, I am not able to access the data. Val Gurdiza, the director of the program, doesn't directly access the data. So we don't use it. We aren't able to access it to review your specific progress. We actually have you submit reports to us on your Enquire data that you're able to share with us. So we're not accessing that on a regular basis to monitor your progress. You are able to access your own reports, and then those you share with us for the purposes of monitoring your BPSO work. And I've had a question about how many guidelines do the academic BPSOs have to implement. Again, it'll be 5 clinical guidelines, 2 across your entire curriculum. So that might be something like therapeutic relationships or person and family-centered care, facilitating client-centered learning, something like that. And then other guidelines could be more specific to a particular course or program, something like leadership, for example. Any other questions? I'm having asked if we make the slides available for download. Yes, we will absolutely make the slides available. We've archived and recording this webinar right now, so we can certainly make that available to you. We are hosting repeat sessions on July the 6th and July the 11th. It'll be the same webinar as what we've conducted today. So if you have other colleagues who you think should listen in, they're welcome to either access the recorded one or join us for one of those 2 dates, and registration is still ongoing for those. Got a few more questions here. Yes, we've been working with Think Research to distribute and disseminate our nursing order sets and have been since the inception of the program. Do the 12 system and healthy work environment guidelines count? Those are our healthy work environment guidelines. They do not contribute to the 5 clinical guidelines. So the mandatory requirement is 5 clinical guidelines, 3 of which must be from that mandatory list. If you wish to implement more than 5 guidelines, which quite frankly many of our BPSOs have, oftentimes they will select from the healthy work environment series. I've just been asked again about academic BPSOs. They need to select 3 mandatory guidelines from the mandatory list that are available for across the sectors, and then 2 additional clinical best practice guidelines for academic organizations. And I'm just looking to see if there's any other questions coming in. There are no costs for the nursing order sets. We've had a question about costs for the nursing order sets, but no, they are available for free for our best practice spotlight organizations. I guess nobody wanted to ask a question verbally, Lolly. Everybody's in it online, but that's just fine. We've got a few more minutes if there's any other questions. Okay, somebody's just wanting to ask a question out, and I think you need to unmute your line. You need to push *7, and it should unmute your line only. I've had a question about the letter of intent and what it needs to include, and it's really a very straightforward, can be emailed to us just indicating your interest in applying and that you understand the scope of the BPSO initiative. You don't need to indicate which guidelines you're planning to implement, et cetera. It's just really that you have your organization's support to go ahead with an application. And you can send that to us by email. Yeah, we'll be able to provide you with some of the measures, the indicators for each of the guidelines, dependent on their sector, and that will certainly be available to you after you've been selected as part of the BPSO program. I'll just wait a couple more minutes to see if there are any other questions. If you want to ask a question by phone, it should be *7 to unmute your line. One of the questions that we've been asked is, can the organization's funding contribution include cost of staff salary dedicated to BPSO implementation? Absolutely. So that contribution can include salary for your BPSO lead. It could also include release time for your champions, the time that your staff may need to be away from their workplace for the best practice clinical institute, et cetera. We've got a question here. Is there a required number of patients or families who must attend Champions Workshop? The Champions Workshops are really not intended necessarily for patients or family members, but I will say that we have had members of the public attend. In those circumstances, it was because the particular organization, a particular BPSO, had a requirement for membership on their committees that all of the committee members be best practice champions. And in this particular example, actually we've had a couple of BPSOs for their patient and family councils, for example, or other committees where they had patient advisors or family advisors. There was a requirement for membership to be a best practice champion. So those have been really the main situations where patients and families have participated in the Champions Workshops. So I've got another question. What is involved in completing the biannual reports? Well, the biannual reports are really focused very specifically on the deliverables that I've just described in the RFP. So we'll ask about progress towards champions. We'll ask, who attended the Summer Institute, some specifics about the implementation of the guidelines, whether it be in curriculum or in your service agencies, what practice changes you've implemented, what education you've provided to staff, if you've made any organization or policy changes to support the implementation. So it's really very much focused on the deliverables and the progress towards implementation. And then once you've been in the program for a period of time and have been submitting data to NCHIRE, we'd also ask you to submit your NCHIRE reports. And those biannual reports, there's a period of time when the online form is available for you to complete. Once the deadline is reached, then we'll print those reports or access them at our end so that we can review them, and then we'll book a teleconference meeting with your team to review and discuss. If you have fully implemented two of the four mandatory BPGs, that's fabulous. And if you fully implemented them across the entire organization, then I would look at opportunities to select another one of those to implement across the entire organization, or possibly select one from another sector if, in fact, that might be applicable to your case. But if you've fully implemented across the entire organization, two of the four, then that would be my recommendation, and we could certainly talk with you about that specifically. We'd be happy to. If you've got guidelines that you've implemented in certain program areas but that would be relevant to spread to others, then that would be my recommendation as well. Okay, we'll just wait another moment to see if we have any further questions coming on the chat line. Okay, well, I'm not seeing any more coming in on the chat line, and I haven't heard anybody on the phone wanting to ask a question, so I hope this has been helpful. We will, as I said, be repeating this session on July the 6th and again on July the 11th. Registration is still open and available if you'd like to have any of your colleagues join. If you do have questions for us after this webinar, you're welcome to email them to me. The details are in the RFP as to where those questions should be directed, and we'll respond to you by email. If you'd like to access the slides, we will make sure that they are available for you probably by the end of the week. Is that reasonable, Lolly? Mm-hmm. Yep, okay. And we'll also have the recording available as well. So I'd like to thank you very much for joining us today. It's wonderful to see so much interest from all of you in this important work, and we'll look forward to hearing from you and receiving your letters of intent by the July deadline. Thanks so very much to you all. Bye for now.